All right. So we're talking about gonorrhea today, popularly known as gonorrhea in Africa. Gonorrhea is a sexually transmitted infection caused by the bacterium Neisseria gonorrhea. It mainly affects the genitals, but can also affect the rectum, the throat, and the eyes. Its modes of spread is through unprotected vaginal, anal, or oral sex. Then I'm from the mother to the baby during childbirth. So that's the reason why it affects the eye. Then we have contact with infected body fluids such as semen, then vaginal fluids. The symptoms varies when it comes to men and women. So in men, there's burning sensation during urination, white, yellow, or green discharge from the penis, painful or swollen testicles, which is most of the time less common. In women, increased vaginal discharge, painful urination, vaginal bleeding between periods, pelvic or abdominal pain. But in most cases, many women and some men may have no symptoms, which makes it easy to spread unknowingly. It comes with certain complications which varies from the species, which is a man and a woman. But in women, there's pelvic inflammatory disease, infertility, ectopic pregnancy. In men, infection of the testicles, then reduced fertility. So in both gender, it spread to blood, life-threatening condition, that's disseminated gonococcal infection, then increased risk of getting HIV/AIDS. Now, gonorrhea can be diagnosed through urine test, swab from affected area, which is into bracket the urethra, the cervix, the throat, and the rectum. Now, gonorrhea can be treated in several ways or in a specific way, which is gonorrhea itself is curable but requires the right antibiotics. So we have injection, which is ceftriaxone, sometimes combined with oral antibiotics, then due to resistance concerns. Now, important, finish all medications, avoid sex until fully treated. Treat sexual partners too. Now, there's antibiotic resistance, which is in gonorrhea. If gonorrhea is becoming harder to treat, the bacteria is developing resistance to many antibiotics. That's why proper treatment and follow up are critical. So, prevention, use condoms consistently, limit the number of sexual partners, regular STI screening, avoid sex with infected partners until treated. Now, gonorrhea in newborns can cause serious eye infections, into bracket blindness. Now, it can be prevented by treating the mother and giving eye medication to newborns. Now, the key points you're supposed to remember in gonorrhea is it can be silent and it shows no symptoms. It is curable but dangerous to ignore. Then, early treatment prevents infertility and complications. I hope this video makes sense. I'll come back with something else another time. I'm out.